Hi, I'm Steve Crear of Indigenous Product, and I know I'm not in proper attire, but we have an incredible show coming to you today of a doctor that I use, Dr. Quraishi, one of the best doctors in preventative medicine I've ever met in my life. His amazing, beautiful, amazing office secretary, Miss Betsy. You're going to see her, and you're going to also have the opportunity to get the help that you haven't been able to get right here in the heart of Oak Cliff. And I truly endorse this doctor. He has a passion for the community. You need to come see him. Thank you.
Hi, my name is Betsy here with Miramar Interventional Pain Treatment Center, Dr. Quraishi's office, specializing in pain management. If you suffer from back pain, knee pain, elbow pain, shoulder pain, any joint pain, feel free to give us a call. We take most insurances, and we have very reasonable prices when it comes to private pay. Call us at 214-282-5257. We're located at 2701 Southampton Road, Suite 150. This is in Dallas, Texas, 75224, Oak Cliff area.
So we were talking about our backgrounds, and you were telling me how you grew up in Dallas.
Right.
I grew up in New York, and when I went to medical school, I graduated 1987, which is 32 years ago.
Yes.
Now, the one thing is this. Medical students in America are taught pathophysiology. They're taught how to analyze and diagnose problems.
Correct.
When they become doctors, this is what they're taught to do. They are taught to do studies like x-rays, MRIs, and make a diagnosis, and then fix the problem.
Yeah.
It sounds fine, right?
Yeah.
There's only one problem. The problem is, why do we let the problem get to be as bad as it is and then try to fix it?
Agreed.
Why don't we put the focus and emphasis on, number one, preventing the problem
Preventative. I told you.
from getting
That's
to
unique.
be bad in the first place?
Yes.
The majority, and this is what's so shocking, the majority of problems can be prevented.
Yes.
Let me just give you just
Yes.
A, B, C, D.
Yes.
I'm going to talk a little bit out of my field also, and I'm going to tell you things that are shocking. First, let's talk about a real bad disease. Let's talk about heart disease. Let's talk about strokes. Let's talk about heart attacks. Well, do you know that long before the person has a stroke, long before the person has a heart attack, there are things that people could do to prevent that from happening in the first place.
Awesome.
A simple
I told you.
simple blood test.
Preventative.
Find out where your cholesterol level is. Find out where the inflammatory factors are. There's something that people don't know. There's something called CRP, which is a test that checks for inflammation.
They don't even talk
And
about that.
They don't talk about that. Most doctors, they'll check your cholesterol, they'll see that it's okay, and worst of all, suppose it's a little high. They will say, you're fine. But reality is, a little high over 20, 30 years
Does the damage.
That's where the damage is. Because really what the doctor should say is, it's not bad now. However, what we want to do is we want to prevent this from getting to be worse. We want to prevent this little high cholesterol from building up plaque in the blood vessels and eventually narrowing and blocking the blood vessels and getting a heart attack. I'm giving this as an example, even though I'm not a cardiologist, but I use this example in the field that I am. I'm in the field of pain, interventional pain. And there's a lot of things that people could do to prevent the problem from getting as bad as it is.
Right.
Let me just say that the majority of doctors, I will admit, they don't put emphasis on that.
No.
They're there.
Conventional.
They're taught the way I was taught back in the olden days to fix problems. So they look at your lab test, they say you're okay, give you a nice clean bill of health and go. But they don't go the
Sure don't.
extra mile. They don't look at what can we do to prevent problems. Sir, I don't know whether I can talk
Steve.
about your condition.
Yeah, sure,
but-
Steve Crear. I mean, all day
Okay,
long.
let's-
Because I'm going to be talking about you on my show. Because you gave me the injection.
Yes.
It helped. You took me to the first phase.
First
Now
phase.
you're going to take me to the second phase.
Absolutely.
And it has helped me. And we were on the phone talking about people who had different surgery that they didn't have to have.
Let's talk about that.
Absolutely.
Steve, I'm going to use you as an example.
Please do.
Let's talk about Steve. Now, Steve presented to me with knee pain. This is a very common complaint because Steve is a tall guy, and every time he walks, there's a lot of wear and tear that
Yes.
happens on the knees. Now, when we're young, we're fine.
Sure.
But as we start to get older, there's some fluid inside of our knee. We call it synovial fluid.
Yes.
Now, it's like oil in a car. You drive a car, eventually the amount of oil is going to decrease.
Yes.
Same thing in our joints. Eventually the amount of oil starts to decrease. And when it does, the bones start to rub.
Yes.
And that's what starts this process called arthritis. Now, by the time the pain comes, the arthritis has already started.
Yes.
So the first thing is, if I could preach to everybody, I would say to them, hey, go to your doctor. And this is, let's say, after age 40. If you're 40 and older, go to your doctor, and even if you don't have pain, go to him and say, I'm older than 40 years old.
Right.
Can you just take a look at my knees and tell me whether I have enough fluid?
Right.
Now, is there a simple test that can check that? Of course there is. A simple x-ray, and you can
Preventative.
see if the bones are closer than they should be, or are they far apart? If they're far apart, it means you're blessed. It means you've got adequate fluid, and therefore you're okay. Wait another 10 years and come back and check it out.
Okay.
But let's say, for instance, the bones are a little closer, but they're not touching. Do you know that nowadays we have lubricants that are...
Did I tell you?
Yes.
I told you he did.
These lubricants are man-made, but they simulate what is in our body, which is synovial fluid. And that lubricant is like pouring into your car 1 or 2 quarts of oil to bring it back up to where it should be. Now guess what? Those pistons move
Working properly.
Working properly, and they're good for, we've been taught,
Yep.
get your oil changed,
That's right.
and your car on a regular basis, and your car is going to last for a long time. Let that oil drop, then you got problems going on. Same concept. And if I were to tell you how many people get knee surgery,
Staggering.
it's staggering.
Yes.
There's so many people
tell you,
who
Raphael?
have knee
I told you.
replacement. That means something happened. What happened? They didn't do preventive medicine.
They sure didn't.
And they got it to a point, it's like somebody saying, you need a new engine. Your engine is frozen. You know, when you don't have enough oil
Right.
and your pistons freeze,
Right.
there's nothing you can do. You need a new engine. By that time, the damage has been done. Now you got to spend thousands of dollars to put in a new engine. Does that make sense when you could have just put
That's
in
right.
$5
That's right.
oil?
That's right. That's
So
right.
the same philosophy applies to the human body. And the way I look at it is this. There's a lots of diagnosis. There's lots of things. Example, in our back, we have discs
Mhm.
that are herniated.
Mhm.
There's so many doctors out
Mhm.
there
That's right.
who don't do
Mhm.
what needs to be done,
Mhm.
and the patient.
Mhm.
Let me give an example.
Mhm.
Herniated discs.
Mhm.
If somebody develops back pain,
Mhm.
and if the doctor does a simple x-ray,
Mhm.
and I'm sorry,
Mhm.
if they
Mhm.
do a simple x-ray,
Mhm.
the x-ray is not going to tell us whether you have a herniated disc.
Right.
They might show some findings
Mhm.
that might suggest a herniated disc,
Mhm.
but the real test is an MRI.
Mhm.
Well, a lot of doctors,
Mhm.
they start putting people on medication.
Yep.
And
Did I
that
tell you,
medication
Mhm.
is pain medication.
Mhm.
Now,
Mhm.
what they don't realize is that pain medication has a double-edged sword.
Yes.
Number one,
Side
there's
effects.
side effects.
Yes.
Shall I tell you some of the side effects? It's going to shock
please,
you.
Please tell them, doctor.
How about
That's right.
kidney failure?
Wow.
How about liver toxicities, liver failure?
Mhm.
How about heart disease?
Mhm.
And this happens over a few years. It
Oh.
doesn't happen overnight. But
Mhm.
does the doctor ever sit down and tell the patients
No.
that, you know what, I'm giving you this medicine, but it's been known to cause this?
Mhm.
It's sort of like
Mhm.
you started with one thing,
Mhm.
never had any kidney problems, and then wind up on dialysis.
Mhm.
If you know anybody who's on dialysis, it's not
Mhm.
fun.
No.
It's
no.
not fun. You have to go and they
Yeah.
put all these needles and they have to drain your whole blood
Sure
and
does. Sure
go
does.
through all this thing.
Mhm.
Just speak to somebody and ask them this question.
And an increase in infections.
Infection,
Mhm.
it decreases your
Mhm.
quality of life
Sure does.
2-3 times a week.
Some
you gotta
more than that.
sit there
Mhm.
and get dialyzed,
Mhm.
and then afterwards, by the way, they are so drained. Have you ever
Drained.
seen somebody?
Yes, I have.
And you know that this is not something that you want to go through.
No.
But how many doctors are out there who actually will say to themselves that instead of putting this person on pills,
Mhm.
let me try to fix the problem.
That's right. Preventative.
I'm going to say something.
Mhm.
Steve,
Mhm. Mhm.
I'm not trying to badmouth the other doctors here.
No, no, we don't
But-
say it like that.
But I am going to
Mhm.
be very frank.
Mhm.
Suppose I put somebody on
Mhm.
medication.
Right.
Do you know
Mhm.
that they have to come every month for
Sure.
a refill?
Sure. Sure.
That
Sure.
means
Mhm.
for the rest of their life,
Mhm.
I'm going to be able to
Write that prescription.
write that prescription, make
Mhm.
some money, make some money. It may not be that much money,
Mhm.
but if I've got 100 people,
Yeah.
it's a lot
It
of
adds
money.
up. Mhm.
And I got a serious problem with that.
Mhm.
I got a real serious problem with that
Mhm.
because these doctors aren't helping the patients anymore.
Not helping them.
They're not helping them. They're
see-
not out there to,
See, he
to try to
cares
look
about
at
the
that.
community.
Because you know what?
Mhm.
If we don't help each other,
Uh-huh.
if we don't think
Mhm.
about what is going on,
Right, right, right.
we're all going to suffer.
Yeah,
We're all going to
absolutely.
And look, in our community,
Mhm.
do we not have? Look, I don't expect
Mhm.
people to know this.
Mhm.
They didn't go to medical school. I
Mhm.
did,
Right.
and I know what the damaging effects are of
Mhm. Prolonged medication.
I know
Mhm.
what the damaging effects are of not taking care of our body,
Mhm.
and I know about these things. And
Mhm.
if you ask the average person,
They don't know.
they don't know, and I'm
Mhm.
not blaming them, but they're not doctors.
Mhm.
I blame the doctors
For
for
not teaching
not teaching
And
them.
educating.
And
That's right.
educate. And then, worst of all, they've got an ulterior motive.
Mhm.
What I mean by that is,
Mhm.
suppose, get this.
Mhm.
I'm going to tell you something else.
Okay. Mhm. Mhm.
This is going to shock you, and I am going to tell
Mhm.
you
Mhm.
that you think that doctors
Mhm.
are out there to
Mhm.
help people.
Mhm.
Well, most
Mhm.
are,
Mhm.
most are, but some care more about the pocketbook
It's just
than they
economics.
think about anything else.
Economics.
And economics, you hit it right
That's
on
it.
the nose, Steve.
Mhm.
Give you an
Mhm.
example.
Mhm.
There was a arthritis doctor,
Mhm.
and the arthritis doctor was one who I went over And I shook his hand and gave him a pamphlet and told him about what it is that we do. And I said to him, if you have any of your patients who've got severe pain in the joints and so forth, send them over to us.
Yes.
Well,
Oh, he didn't like that.
no, initially he did. Because he had some people who really had bad pain.
Okay.
So there was a patient who had knee pain.
Right.
So I did exactly what I told you a few minutes ago.
Right.
I gave them a lubricant.
Right.
You know, when we put that lubricant, they're good for a whole year. Okay?
Yes.
So guess what?
Or longer.
By the time we gave those 3 lubricant shots, they said their pain went away.
Yes.
I was super happy, but guess who wasn't happy?
The doctor. He wasn't happy.
He wasn't happy. Now, I didn't know this, but initially he started sending me a bunch, and then all of a sudden, I stopped.
It just stopped.
It just stopped. And I get a lot of people who come in on their own, and I get patients who are referred by other doctors. So most of the times, I didn't even realize that he had stopped.
Wow.
Then one day, I met him at a conference, and it then dawned upon me that we hadn't seen any of his patients for close to a year. So I came over to him and I asked him, you know, is there anything that I did wrong, or did any
No, you did something right.
patient
That's what it was.
complain or anything, because I didn't know what was the reason why he stopped sending. And he took me over to the side of the room. He didn't want to speak in front of anybody. And he said to me, no, doctor, you know what, you're very good at what you do. In fact, you're a little too good. That's what I said.
That's what it was. That's what it was.
I'm telling you, I didn't quite understand that, right? So I said, what do you mean? And he said, you know, this is his exact word, and I hate to say this, but he says, it's a business that we're in.
Right.
It's a business? Wait a second. Wait a second. Yeah. We all work for money. But when we realize we're dealing with people's lives.
People's lives.
We're dealing with people's lives. And I wonder to myself, how can somebody go to sleep? How can they be at peace with themselves, knowing that if you didn't give somebody the proper advice, or you didn't do the proper treatment, and they're 5 years later are going to suffer. You know, there are people who have knee replacements, and they don't make it out of that operating room.
See,
You know
I
that?
told you, CW, because of the trauma. And this man is saving lives. He's saving lives. Because that's trauma when you are going in and a bone saw is cutting through. This doctor, and this is in the Oak Cliff area, the majority of our people don't even know that there's a preventative doctor in this neighborhood on this caliber. This was a miracle to me when I met him, because I've met many orthopedic surgeons that'll go in and say, replace the knee, replace the knee. But one that says preventative, we're gonna save the knee, this man is rare.
And Steve, you're very, very right. Because surgery should be the last thing. I have in 32 years, I've seen people die on an operating table. When I was in when I was in medical school, I was a student, and one of the first things that shocked me was when there was this lady who was getting ready for surgery, and the anesthesiologist started putting medication into her veins. And the surgeon and I we walked, I was his assistant. So we walk into the room, we haven't even started the procedure, and the anesthesia is being poured into her veins. She starts to convulse. And I am a student. I'm a second year medical student, and I have never seen that before. And if you've ever seen somebody come off the table convulsing, it is a scary sight.
Yes.
It is a very scary sight,
Yes.
because you see you see the pain in the person's face, you see their body convulsing and so forth, and you see them die right in front of you.
Yes. Yes.
You see
Yes.
them die right in front of you. It didn't happen because of the actual surgery. It happened because of the anesthesia.
Accident. My brother, I gotta say this, my brother had a knee replacement.
Okay?
He had to be rushed. I believe it was Baylor Hospital.
Okay?
He had 4 or 5 blood clots
Wow.
go through his heart
Wow.
after the surgery had been done.
That's right.
4 or 5 blood clots. So
That's right.
what he's saying is true. That's why I tell anybody, preventative, you can always get the surgery, but you can't unsurgery the surgery once it's been done. If you can go the preventative route, like
Right.
with Dr. Caress, why not?
Why not? And you think about it. You know, God made our bodies to function in a certain way. When a surgeon takes a knife and he cuts, and he
Trauma.
takes metal and he puts it in,
Yes.
and that is very traumatic.
Thank
that can
you.
cause blood clots,
Yes.
like what happened
To my brother.
to your brother. It can cause infection. It can cause problems with scarring. It can cause other things that were not even anticipated. And if there's a way to avoid all of that in the first place, that's my emphasis.
Boy,
I
this
think
is
that's
awesome.
that's my emphasis.
Right.
Now, let me say one more thing.
What an interview. It's
The
awesome.
the field of medicine evolves, and when it evolves, new things come on the market. I have one more little gripe to talk about other doctors, and again, you know, I will be the first one to admit I'm not the smartest doctor in the world. I'm not the
You're a good one.
most knowledgeable. But one thing I will say is this. If a doctor just does his best, then you know what? I am sure that people will appreciate it and they will benefit from it. One problem that I have is that a lot of doctors don't keep up with the changes. There are things that are out on the market now that were not there 10 years ago,
That's right.
20, 30 years ago.
Like what he shared with me, CW.
I'll give you one example. If you ask your typical doctor, do you know what a stem cell is? Do you know how stem cells can repair tissue without the need for surgery? Or how stem cells help regenerate the body? The majority of doctors won't know it because this is technology that is very, very recent. And I'm giving stem cells as one example. I could give other examples of where there are new techniques out in the medical community that doctors have to be aware of. And if they don't keep up with what's going on, they're only going to say the same thing to their patients that they did 20, 30 years ago.
And you know what, Doctor? You said something about the cortisone shot.
Yes.
That's not the best shot.
It is not.
See,
it is not.
See, that's awesome because it's not.
It is
and
not.
he knows that, see.
Let me talk about that. There's a lot of things I could talk about, but
Yeah.
I'll talk about cortisone. Number one, cortisone has a lot of side effects. First and foremost, it affects our sugar status. So people who are borderline diabetic or are diabetic, they can see their sugar levels rise a lot.
Spiking.
Number two,
Mm-hmm.
cortisone can cause secondary problems with thinning of bones. It is a
Wow.
common cause of osteoporosis. And people don't know that.
I don't
Now,
know that.
this is what's so ironic. And let me tell you, suppose somebody has early arthritis and the general doctor, see, when you have a cortisone shot and that cortisone shot causes thinning of the bones, the next thing that can happen is either a fracture or
Wow.
the spurs can get fractured. Why? Because the bones have gotten thin.
Then
And when that happens, that is going to actually make the arthritis
go
worse.
complicate the problem. Wow.
Absolutely. If you, I'll give you an example. My cousin, he played football at SMU. Young kid, but he got tackled and he broke his tibia and he had an ACL. So they had to do surgery. They did an ACL repair and they fixed his bone. Just 5 years later, he wasn't even, he was still in his 20s. And if you took an x-ray of that knee compared to the other knee, this knee looks like it's 30 years older. Why?
Wow.
Because arthritis kicked in. When fracture happens, arthritis can kick in if the fracture involves the joint. If it involves the joint. If the fracture is in the middle of the bone, like along the shaft, then that's not where arthritis develops. So the problem that can happen there is abnormal angulation and things like that. But if it happens in the joint, it can cause arthritis. That's why cortisone is so bad, because if we fracture into the joint, you're trying to help somebody with arthritis, and guess what? You're going to make that arthritis 10 times worse. That's why, you know, it's you gave the example of the cortisone, and that's one thing. The other thing that cortisone does is it increases our stress. It can cause hair loss.
Wow.
Yes, look it
They
up.
don't know that, see them?
They don't know that. Cortisone, if given over a long period of time, cortisone is a stress hormone. What happens when we're stressed? We start losing hair.
Right.
And if you've got it pouring into your system and it's in your body, we're in a constant state of stress.
And stress can kill you.
And
Sure
stress can
can.
kill you.
Sure
It can
can.
age you. It can kill you prematurely.
Sure could.
That's why, you know, that's my emphasis. That's what I'm about. I'm about doing the simple things to try to help people prevent problems from getting worse. And again, I'm not here trying to tell that the medical community is bad. I'm not saying that. I'm saying most of the doctors out there care about their patients and they do the right thing. But it's important that a physician try to look out for the patient's benefit in the long run.
Absolutely.
Look at the bigger picture.
Absolutely.
I started this whole discussion by saying this. I was taught, identify the problem, fix the problem, and you're done. No, that's not the way to do it.
Preventative.
The way to do it is before the problem starts in the first place.
That's right.
Think about the broader picture and prevent the problem from happening in the first place. That's I think the one thing that I want to emphasize.
Well, you know, I gotta say this. You know, preventative is rare in doctors anywhere in the Metroplex. And this doctor came in, took pain out of my knees. That was the first phase, and now we're getting ready to go to the second phase. And the only thing I can say, the people listening to us, you know, I'm with Indigenous Product, but I endorse this doctor because that right there is a rarity to see a doctor with this kind of passion and energy. Our community needs him. I need him. So the thing of it is, I'm just saying, thank you so much, Dr. Curtis.
Thank you. Thank you for giving me an opportunity to speak to the folks out there.
Oh, we're just getting started.
And let me say, I'm here, and if people have specific questions, next time, pose them to me. I will be glad to spread the word and tell them my advice on certain medical topics. Today we just talked in general, and later on I'd be more than willing to talk about specifics of specific individual issues. My doors are open to people who want to come and see me, but I am telling people that when they go back to their doctor, what they need to do is say, "Doctor, I want you to look for my best interest in the long run. I want you to tell me, what do I need to do?" Just be frank. Just, you know, just tell me A, B, C, D. This is what they suggest, and give me guidance on how I can change things and do things to prevent problems in the future. Everybody should demand this of their own doctor. They need to look them in the face, and the moment a patient does that, you know what happens? Now the doctor says, "Oh wow, I got a smart patient, and I better be on my toes. I can't just say, okay, you're fine, come back to me." You know, it puts them in check, and we have to be in check, because if you let a doctor just treat you like you're just another
conventional line therapy.
That's right.
Well, just to make it easy on themselves, they just need to come over and see Dr. Chris. Come see my doctor. They need to come see you.
Sure. We'll be glad. We love seeing, I love taking care of people. That's what I do. And that's, you know, that's what nothing makes me happier than saying, I did something good.
Awesome.
Think about this. Think about this. We're all going to meet our maker.
Of course.
We are all going to. But imagine if we go and we say, in my life, I did something that helped this person, that helped this person.
That person.
You know what? We're going to get rewarded.
Yeah, absolutely.
And that's how my philosophy is. If we're, you know, if we think in those terms, as a community, we help each other. That's all.
And this is the passion that I saw, CW. That's the energy and passion I saw from Dr. Quraishi.
What a great
They need
show.
to come see him.
Great
This
show.
is awesome. This has been a great interview.
Thank you, Pat.
Thank you, and I appreciate you giving me the time. Thanks.